Hi, I'm Carly Espinosa, and my presentation topic is strabismus, which is an eye condition which I have and that I've had eye surgery on. Um, so strabismus is a visual condition where the eyes aren't aligned properly, and so they look in different directions. More specifically, one eye will look straight ahead, while the other eye will deviate either in the upward or downward direction, or to the left or to the right. So almost 4% of children actually have strabismus, but it can also develop in adulthood. An interesting thing that I learned about strabismus is that there's actually different types of strabismus. So for example, infantile esotropia is a common type of strabismus that obviously infants get, where both their eyes can't be used together because one will deviate inwards, and so they don't, like, their brains don't develop enough that they know that their brains want to have these two images work together. So then vision in one eye will just be completely ignored, and they'll only really see out of one eye. And accommodative esotropia occurs in children usually 2 years or older, where they try to focus on things that are either far away or close up, and they're squinting really hard, which causes their eyes to turn inward, and that just worsens over time. So with strabismus, we have 6 different eye muscles attached to each side of our eyes, which control the movement of our eyes. So as you can imagine, all these muscles must work together in order for us to correctly see things, because how our vision works is that both eyes aim at the same spot, and you'll have 2 slightly different images, but they're of the same angle, different angles, but they work together, and then your brain will combine these images to give you a 3D perception of whatever you're looking at. And so even if just one muscle in one eye is slightly out of alignment, then that'll completely mess with your vision and cause you to have all these issues with strabismus. So this can cause, when children have strabismus, they have really poor depth perception because their brains never develop for them to see this 3D image, and so they just kind of see things in a one-dimensional sense. Like, they don't always see 2 images, but the images don't exactly lay over each other like it does with everyone else. And adults with strabismus, when it develops over time, they'll just get really bad double vision because their brain was usually accustomed to seeing this 3D image, whereas now their eyes looking in different directions, their brains can't exactly put those images together. And from my research, I learned that adults can actually get strabismus from things such as cataracts or eye injuries, so it's not always a genetic thing. And speaking of genetics, experts believe, but they can't exactly prove that strabismus is genetically related, but it seems like it is because as the internet and all these articles and journal entries say, is that parents with strabismus will usually have children with strabismus, and even for my case, my mom has strabismus, and then my stepbrother and I also have strabismus. So there's very limited treatments for strabismus just because it's, like I said, only 4% of children have it, which is a large number, but it's also not an extreme condition where it'll cause, obviously it's not severe. So really the only ways to treat it is, for infants, they'll typically patch one eye, which is the stronger eye, to make the weaker eye become more dominant, and then hopefully the 2 eye images will then come together again. But this treatment has to be done very early on because it doesn't always work, and it usually doesn't. But if you do it super consistently and the patch is always on during the daytime hours, then the brain will soon begin to develop, and the eyes the weaker eye will begin to become stronger. And then usually with children a little bit older, what the eye doctors will do is prescribe them glasses where one eye is stronger than the other to try to get the strength of these 2 eyes to match each other, which this doesn't exactly cure it, but this definitely treats the issue. because then the third treatment that I'm about to talk about is much more extreme, which is surgery, which doctors prefer not to do on children just because their eyes are still developing. And even as adults getting the surgery, you'll need to have the surgery multiple times because your eyes just continue to change over time. So for the surgery, the ophthalmologist makes a small incision on the tissue covering the eye to reach the eye muscle. So it's very minimally invasive. Like, they just cut on the side. And it's very, like, tailored specific to the patient. Each surgery is very different. Like I said, there's 6 muscles. So they really make it so that you can have the best outcome with this surgery. Usually, though, the weaker eye, they'll tighten the muscles. So this is done by detaching the eye muscle from the wall of the eye and then repositioning it. Or they'll do what's called tying knots in it, which will just tighten the muscle without detaching it. But despite how complicated the surgery sounds, it's really not that bad. And the recovery time is only a few days, and that's mostly just from the effects of the general anesthesia that the patients are under. And during the recovery, there's very minimal pain, like just ibuprofen or over-the-counter pain relievers can really just get rid of that pain. But also, like, the only other really recovery effect is that the patient will have double vision just because their brain isn't really accustomed to now being able to see in one image, so the brain needs to get used to this. And there's no really big complications in this surgery ever. From my research, like, optometrists do this surgery over and over and over again, and it's very minimal surgery, like I mentioned. So there's, like, the only, like, extreme risk that there ever is retinal detachment, but this is super rare. But one kind of issue with the surgery is that it's not quite perfect because, like I said, eyes develop over time, so you'll need to have, like, multiple surgeries. So, like, in my case, I had my surgery about 5 years ago, but I'll definitely be needing one sometime soon. But yeah, that's all I had to say. Thank you so much for listening. Bye.